This is Mount Prospect Mayor Arlene Juracek with the Village COVID-19 update for May. First, I extend a hearty thank you to everyone who's extended a helping hand to our neighbors and family members, our first responders, teachers, and medical care providers. It has been phenomenal to witness the creative ways you've chosen to express your concern and support. And I appreciate the entrepreneurial forces at work among our businesses, who are finding new and unique ways to assist in staying afloat while tempering the spread of COVID-19 virus. If the emotional health of a community can be measured by the amount of grassroots entrepreneurial support efforts it generates, then we're doing pretty well. It's been said that we're all in the same boat, but I've also read that we really aren't all in the same boat. We're in the same storm, each in our own separate boat. Some are better able to navigate through this storm, while others need help to stay afloat. We've all recognized this need. The Village has done a number of things, such as extending due dates on utility bills and vehicle stickers. And for our restaurants, we've extended our liquor licenses, which expire in April, into the fall without charge. And we've relaxed our rules on wine and beer deliveries in accordance with recommendations from the Illinois Liquor Commission. In the May-June Village newsletter, which has begun arriving in our mailboxes, it outlines some of the ways you can stay connected while sheltering in place. I direct your attention to the Human Services article on page 10 and urge you to call Human Services if you or someone you know needs assistance. A list of resources can be found on our website, www.mountprospect.org, where you'll also find up-to-date information on canceled or postponed events. Click on the COVID-19 link at the top of our Village homepage. On our COVID-19 page, you'll also find a path to the Cook County Department of Public Health. Click on the COVID-19 tab at the top of that page, and this is where you'll find COVID-19 statistics by community and where I go frequently each day to get updated numbers for Mount Prospect. As of this morning, April 27th, 813 tests have been performed on Mount Prospect residents, and there were 198 diagnosed cases of COVID-19 in the Village. And thankfully, only one recorded COVID-19 death, which sadly occurred in mid-April. If you wish, you can go directly to the Cook County Shiny app, it's SHINY-APP, at ccdphcd, so Cook County Department of Public Health CD, .shinyapps.io/COVID-19 for the latest data. An interactive map allows you to bring up the numbers for all the Cook County suburbs. I do caution you, however, and urge you to not get alarmed with any numerical comparisons among our suburbs. The reporting, as I understand it, is done by zip code, not by municipal boundary. So some of the numbers of our neighbors look unusually high for that reason. What you might want to do is what I've done is just put it on a quick access link on my phone so I'm easily able to get those numbers over the course of the day. And if you notice, the governor has been doing a daily press briefing at 2:30, and right about that time is when the numbers get updated. Now, all these numbers reflect the fact that more testing is being done throughout the state. We've all been advised for quite some time that many of us are asymptomatic, yet carry the virus. So we're getting a sense of just how prevalent it is, even if we don't feel ill. The numbers are showing up in the tests. That test rate showed about 25% of the tests are coming up positive. Our death rate, fortunately, is very low, which suggests to me that we're taking good care of ourselves and each other. But I'm sure it's also a product of having no assisted living facilities in Mount Prospect at this time. We value our seniors, so let's keep taking good care of them. Illinoisans are being asked to take precautions through the month of May, including facial coverings in indoor retail settings and outdoors where social distancing can't be maintained. The point is to limit our potential to shed viruses to keep ourselves from infecting others. Now, we know that PPE, or personal protective equipment masks, are in tight supply for us first responders and medical personnel and really aren't recommended. So what do I mean by PPE? Well, you've heard a lot about N95 masks. I happen to find this one in my garage. It was left over after a long ago insulation project. It's a little dented. If you happen to have these in your garage, feel free to go ahead and use them. But I wouldn't go on a major manhunt to get these unless you're medically compromised and your physician has recommended them. The other thing is procedure masks. These are also for medical personnel. They're disposable. Both of these are disposable. Now you might ask me, where did you get my box? This box is 20 years old. Way back in the early 2000s, when the avian flu pandemic was making its rounds, my employer at the time gave us all an avian flu kit, and this box was in them. Well, I finally got to use them 20 years later. The problem with both of these is they're designed to be single use. And I started out by using these procedure masks, and I made 3 stops in a day. I went to Menards to get a rake, I went to Aldi, and I went to Fresh Thyme. And I took the same mask on and off. And by the time I got home, it was pretty ratty looking. You really shouldn't be using these over and over again for an extended period of time. So even if somebody gives you 6 of these, they're only going to last you a week or 2, depending on how long you go out. So these products are really designed to be single-use items. They really can't be sterilized, despite what you may have seen on TV or on the internet. Some hospitals have ways to do the N95s, but there's really nothing available for home use. There's a much preferable way to do this, and actually a much more comfortable way to use this. Cloth coverings are preferred because they can be washed and you can use them over and over again, and they're easier to breathe through. On the day that I went to Costco and wore one of these, I had a hard time breathing because you're waiting in line and going up and down the aisles, and this one was not that easy to accommodate. Cloth coverings are preferred, and they're a benefit to people who have a hard time breathing through these other products. Cloth masks are easily washable using ordinary soap and water. So as has been shown in a number of places, the COVID virus is surrounded by a lipid or fatty layer, and it's the soap that helps dissolve that. So you don't need to use any fancy extra strength super hot water or bleaches or anything of that nature. Good old-fashioned soap and water is really going to do the trick for us. So there's a few options for fabric masks. You can get a nice sewn mask. We've got a number of sources throughout the village that are sewing and making these available, especially to our seniors. You can buy them at a number of our stores that are open. I've seen them by the cash registers, and they really work very nicely. They're thick, they're multi-layers of fabric, they have ear loops. You can put them on and, again, put them over your ears. These are designed to keep your germs to yourself. So they're really not that great at protecting you from spray coming towards you. They're not a perfect seal. So there is this sewn mask, which, as I've indicated, is very good at keeping your germs to yourself and others' germs to themselves and preventing the transmission amongst other people that you encounter. If you're not quite up to this or you're having a hard time finding one of these, here's another option. I'm sure you've seen this on TV. I actually made one. You take a regular old bandana, fold it up, get some hair ties, loop your bandana through it, and you've got a perfectly acceptable mask. This is just a straight bandana and hair ties. Got this colorful package of multicolors to match your bandanas. And if all else fails, there's just the plain old bandana. Surely we've got these hanging around, maybe grandma's handkerchiefs, whatever. They're only 2 layers of fabric. They're not the best. They're not the most comfortable because they tend to slide down. But in a pinch, this is a perfectly acceptable alternative. Now you notice I haven't brought any gloves with me. And gloves are not recommended for 2 reasons. Many people are using them the wrong way. And frequent hand washing and sanitizing are much more effective than the way people are using them. In addition, there has unfortunately been an appalling lack of consideration when disposing of used gloves. If you wear gloves, remove them carefully and dispose of them in a trash receptacle. If there's no receptacle, carry a bag in your car. So when you can dispose of your gloves, put them in the bag in your car along with your disinfectant wipes and throw them in the trash when you get home, not in the recycling bin. Now, during this difficult time, the village board and I, along with the hardworking village staff, are doing our best to evaluate the situation, make the safest decisions, and inform residents of the results. Illinois has been under a pandemic prevention scenario since St. Patrick's Day. We know that anxiety, depression, cabin fever, and stress are high. Please reach out to the resources I mentioned. Go to the website. Again, you can find them very easily. Check that village newsletter. And in addition, the state of Illinois has provided a measure to assist in maintaining emotional health. Text the word TALK, T-A-L-K, to 552020, or hablar, H-A-B-L-A-R, for service in Spanish to the same number, 552020. You'll receive a text back with information on a mental health counselor who can call and listen to you and perhaps refer you to appropriate resources. What we do know is this will not be a normal summer. Mount Prospect as a community has demonstrated the creativity and mutual support to make it the best it can be. There are signs of hope in our economy. The finance department has sold a record number of real estate transfer stamps, and community development has issued record numbers of permits online. And Human Services is working hard every day, assisting with food and social services to ease us through this crisis. Our staff will continue to put our citizens first and help in any way possible. Be safe, stay healthy, and stay strong, Mount Prospect.